Hi guys, this is Charles. I'm one of the surgeons at Southpaws. Just took an interesting radiograph, which was a MET check on a dog that has a soft tissue sarcoma on the front digit, and there are lots of interesting findings here that I thought I would review. So the first one is, if we look at the caudal humeral head here on, I'm not sure whether it's the right or the left, you can see this radiolucent line right here. And the concern would be that it's an old OCD lesion or a old fracture or something like that, but it turns out that it's just an artifact, and this is in fact the contralateral scapula coming down to this humeral head down here. So that is not a pathological finding, it's just it's just the scapula from the other leg. So moving across onto the rest of the radiograph here, we can see that we've got multiple areas of bridging spondylosis in the thoracic spine. And again, that is not, it's pathologic, but it's not often symptomatic. So usually this can be associated maybe with a little bit of stiffness, but often not any pain or anything like that. And the other thing that we see on this radiograph is multiple little white dots that are very irregular on all of the lung fields. And these are just pulmonary osteomas. So again, not pathological, no sign of any cancer or anything like that. Now, the other thing that we see is a very large heart. This dog is a Cavalier King Charles Spaniel, and it doesn't have mitral valve disease. Now, looking caudally, the other thing that we see is all of this calcification here, and this is all calcification of the biliary tree in the liver. Now, if we switch over to the ventrodorsal radiograph, you can see again that calcification throughout the liver around here. So again, that is, while it's pathological, it's often not symptomatic. So let's just see if there's, so this is the other lateral radiograph, and again we can see all of that calcification within the biliary tree. Again, multiple pulmonary osteomas, and when we look on this radiograph where the humeral head is not superimposed on the other scapula, you can't see that radiolucency on either one of those humeral heads, so that tells us that it's not in fact pathological, and that it was a superimposition artifact from the superimposition of the contralateral scapula. You can see that here, contralateral scapula overlying the humeral head. So just some interesting findings, and that I thought I would post. Thanks for watching, and like and subscribe the video and the channel.